what will the registry mean in 5 to 10 years? Well, that really is down to how many people join the registry, because the more we join, the quicker that we can come up with some of these answers. Even so, we do need some time to look, because what we like, the most scientific way of looking at a question is actually to start off from a point and then observe going forward rather than, going backwards, if you like. So we will need a period of time to collect the data, see what happens, and then report. So hopefully in about 5 years' time, within 5 years' time, we will have published some of our findings, and I'm almost sure that we will end up combining that with other groups. So it won't be a standalone thing; it'll be with other groups, and we can then bring that back to the community and to the clinical teams that serve the community. Okay, so I mean, I see the registry as the first step along the way to improving care for the P10 community. And ideally, what I think, what we should be aiming for is to have some national clinics, and these could be virtual clinics where people with P10 that people with P10 could access, and in these clinics they would have access to all the relevant specialists who could then advise their local team about any particular complications that they have, or if there's any particular queries that they have or any concerns. And if everyone had access to that, I think that would be a fantastic way of providing the best care. Because at the moment, it's hard for people to travel to clinics. No one knows where the specialists are, and so things are difficult and not organised. But I think they could be much better organised, and in a way, through COVID, through the fact that we're all doing much more through video now, um, that is perhaps one of the silver linings of everything that we've been through in the last 18 months, that people are, everyone's happy to do more online and go to virtual clinics. And I'm not saying these would replace what you have locally, but this would be an added extra for those difficult complications or rare or unusual things that we think may be related to P10. So one of the main remits of the P10 Research Foundation is to develop new therapies to, for both the prevention of complications and the treatment of complications. Now, any new drugs that you want to put in a trial, you need access to patients for those drugs, and with a rare condition like P10, it can take a long time to find enough patients to have a trial. So the other advantage of having a registry is that we then have a ready list of patients who might be eligible for a particular drug study, and that will speed up the research, the clinical research. So that's an added bonus of being involved with a registry, and I think that's something else that it will give back to the P10 community.